All right, we're good to go.
All right.
All right. Hello, everybody. Welcome to our first episode in the UD Mental Health series. We have a lot coming up, and this one is about communication. And we have Mr. Abhi Saxena here with us today. How are you?
I'm doing well. How are you guys?
I'm very well too. And he's a Vanderbilt psychiatrist, if I'm correct. And that's exactly who we need at a time like this. And we're about to go back to school on August 12th, especially right now. So we need to get a lot of questions answered. We have a lot of stuff to talk about regarding our mental health. And we're really glad to have you on. So before we get started, tell us a little bit about yourself.
Sure. So again, like you said, my name is Abhi Saxena. I am from Macon, Georgia. I lived most of my life in Georgia. I went to high school, middle school, everything in Macon, Georgia, Central High School graduate. And then I went to the University of Georgia for undergrad. Studied cellular biology there, took some political science classes, really interested in stuff like that. And then went to Mercer University. I think you can see that just behind my head there. That's my medical school diploma. And had a great 4 years, again, still in Macon, went back to Macon. And then got into a really nice residency program here at Vanderbilt University in Nashville, Tennessee. And so did 4 years of training here. My fourth year, I was lucky enough to be the chief resident. So really loved it here, but wanted to come back to Georgia and help underserved communities. So I went back to small town, Tifton, Georgia, and Adel, Georgia, in South Georgia, repping that shirt, Sylvia Bar Center. That was one of the geriatric psych centers that we started down there. Had a great 4 years down there, was lucky enough to get an MBA, did a weekend program, got kind of interested, 2-year weekend program at Mercer. Got interested in the business side of healthcare, leadership, administration type of things. And now I'm back at Vanderbilt. I'm the medical director of hospital services for our flagship hospital here in Nashville. And, looking forward to the years to come, hopefully be here for a long time.
Thank you.
And can you go ahead and explain a little bit about what a psychiatrist does and what roles you guys play?
Absolutely. So this is a very good question because people aren't very sure because, you watch movies and stuff and you see a psychiatrist with a sofa and like maybe smoking a pipe or something and, nodding and writing a few things on their pad. And so psychiatry is very diverse in terms of how you practice it. So first of all, very basic, you need 4 years of high school, 4 years of college, then 4 years of residency training, 4 years of medical school, and then 4 years of residency training. So it ends up being about 12 years after high school of training to get to the point of becoming a psychiatrist. You're working under the board of something called a board that's certifies you in both neurology and psychiatry. And so you're kind of within that board of where you work. And you kind of become the penultimate decision maker in behavioral health. Whether you want to or not, sometimes stressful, you kind of are where people look to for final answers on diagnosis, medications. That's sort of what sets us apart from other positions in behavioral health. Us and nurse practitioners are the only two folks that can write medications. And so we really specialize on medication management, diagnostic ability. We also do some procedures, ECT, electroconvulsive therapy, TMS, transcranial magnetic stimulation. These are some procedures that psychiatrists can do. But we really specialize in depression, anxiety, schizophrenia, bipolar disorder, PTSD, addiction, all the substances, opioid use disorder, alcohol use disorder. And that's kind of what we do. I'm happy to answer more questions if that was too broad or general, but I think we mainly specialize in taking care of people who have brain disorders that affect behavioral ability to function in society.
And many people oftentimes confuse psychologists with psychiatrists or confuse a therapist with a psychiatrist. How do you guys differ? If you could explain about that.
Sure, another good question. we all do really important parts of behavioral health. So I cannot do things that a psychologist can do, and psychologists cannot do some things that we can do. And so we need each other very much. So sometimes people, try to make it very much like it's cleanly divided. It's not. Psychologists do therapy, testing, diagnostics. They are usually go to a 4-year or 5-year graduate program also, just like doctors go to medical school. They do a PhD or a PsyD. So they have a lot of years of training as well. They mainly focus on therapy and testing to mostly, and I don't want to say that's all that they do. Those are their kind of ultimate top of their license things that they do, taking care of patients. And then we do more of the medication management, diagnostics, and some of the procedures I mentioned. But there's a lot of overlap. Good psychiatric programs have really good psychologists. And most psychologists, in order to take care of patients, have to have a relationship with a psychiatrist if folks need medications to refer them to. So it's a very close kind of partnership.
Yeah, and so you mentioned medication management. So to what extent do you think medication is essential in treating these disorders when it comes to the brain?
Yeah, so this is a little bit tougher to answer because I don't think for everything going on, medication is the answer. There are varying levels of dysfunction. And for a lot of things, people can try at first to eat well, kind of get in good routines, sunlight, fresh air, exercise, things like that, counseling, and really try to do everything they can within their power to improve their state. But there's some times where you could be doing all of those things and it just doesn't get better. There are even times where you can't do any of those things because you're so sick, you don't even feel like exercising or eating healthy, all those regular things we know help us. And so at some point, I believe if your brain is not making the right amount of chemistry, they're downstream modulators like dopamine, acetylcholine, serotonin, norepinephrine. If these are dysregulated in our brain, you can make some effort at improving these with exercise and diet, but at some point you may need medication to help modulate those. And so just like if somebody has diabetes, we all know you should exercise and eat healthy, but if your pancreas isn't making the right amount of insulin, you're going to maybe need some insulin. You may need medicine to help your body. I see the brain as the exact same thing. If you're not making the right amount of whatever you need, it's very hard to just make it happen. And so sometimes you'll need medication to help you.
Right. And branching off of that, and you probably observed this with some patients, and you probably feel like medication is what should be prescribed to them because their lack of, I guess, lifestyle, we can say, or communication was not there. And, so as a psychiatrist, what can you recommend people do so they don't have to resort to medication as an end result?
Yeah, so the first steps are pretty simple. Kind of take good stock of how you're doing. Maybe keep track of how you're sleeping, how you're eating, how your relationships are with people. Notice if you're like getting a little bit more on edge, if you're getting down or depressed or anxious. Kind of keep a true, honest kind of journal or kind of how you're doing. Be honest with yourself. And I think the real point is if it starts becoming dysfunctional in your relationships, your school, your work, if something is actually breaking down in your ability to function in society, I think it's gotten past the point of you just being able to will yourself out of it. You're going to need to go get some help. And that's where if you don't want to do medicine, you can start with counseling, therapy. That would be the first step. And then you can get in front of a behavioral health expert. And if they feel like this is not going to be enough, they can always refer you to a psychiatrist, or even primary care doctors can write medicines for depression and anxiety. So just get to a doctor at that point that, these first steps aren't working.
So obviously, I guess what you just mentioned is for recognizing these signs in us, recognizing what we're going through. How about on the outside? Because some people, they won't go get help. It's unfortunate, but there's either they're stigmatized or it's something that they just don't want to do. So how can we recognize these signs in people that are around us and try and get them help?
Wow. I mean, that is easier said than done, right? Because especially there are disproportionate groups in our society that do not go seek mental health care. African American community, Hispanic community, disproportionately gets less care by mental health than they actually need. And there's a long history, and there's a reason. This goes back decades, where even during the civil rights movements of the 60s, where psychiatric diagnoses were kind of used to limit people who were protesting or were trying to demand change. And you can imagine kind of a difficult scenario where if you're really passionate and you're trying to advocate for change, and then somebody labels you with a diagnosis that now puts you in a hospital, it locks you up, how scary that would be. And that really did happen in our own country just not very long ago. And so we've come a long way. I think my profession has had to look ourselves in the mirror and make sure that we're doing right by people and we're not having despair, so all this to say, it's not just because people are hard-headed or not wanting to get help. There's a background to why people aren't getting help. But we got to break that. Like your generation, we got to just destroy the stigma. We got to say it's okay to openly talk about depression and anxiety and addiction. And I think we're getting a lot better. I think we're a lot better in 2020 than we were in 2010 or 2000 or 1990. We're talking about the opioid epidemic, prescription drug epidemic. Like in the 80s and 90s, cocaine was a big deal, and we did not really treat it as a mental health crisis. We treated it almost like a moral crisis or something was wrong with people. That is not how we look at it now. We know that your brain gets into this circuitry of addiction where you cannot break out of it without help. It's not someone's being a bad person. It's not someone who's not being moral, all these things that sometimes people used to throw around. It's a legitimate scientific issue. And so getting all the way back to your question, if you see somebody around you struggling, and we all know what that looks like. They're not like themselves. They're not kind of taking care of themselves. They're just off. Talk to them. Be very open. Sit down with them. Maybe start with saying something like, I hope you don't mind me just wanting to touch base. You tell me everything's fine. I'm gonna believe you for right now. But I just noticed, last few days, last few weeks, few months, things just aren't going well. Are you okay? You will not believe, just like that simple opening up, how many people will actually take you up on that and talk to you, and then you guys can kind of work to something and get people help. It never works to really force a friend or family member to go get help. But it does work to be open and listen. And at some point, you may have to resort to something more aggressive to get them help. But to start with simple conversations, listening, really trying to be present, not be rushed, easier said than done in our society. These are ways I think you can kind of open up that communication that tears down some barriers. I don't know if I fully answered your question, but.
No, you did, actually. You actually did. I was just thinking about it because there's people that I know that are going through things. They're tired, they're weary, especially right now with the current situation, you can't really go see anyone. You're locked, you're cooped up in the house. Prospects are kind of looking bleak right now. So it's really challenging and very tough for a lot of people. And at the same time, a lot of people will just simply not go get help. So understanding how to reach out to them, how to contact them to try and see what's going on is extremely important, especially right now.
I couldn't agree more. We kind of all know the public health situation with COVID-19, and we know like how important things are that we're doing and like locking down and all that stuff. Like we get it, from a public health infectious disease perspective, we understand. But the side that we're not talking about enough is what is this doing to folks' mental health?
Exactly.
Depression is up, anxiety is up, paranoia is up, drug use is up, overdoses are up, other things that are even tougher to talk about, like abuse is up. Think about where school was a safe place for kids to go, for 8 hours a day, 10 hours a day. Sometimes they got their only meal of the day, consistent meal of the day at school. You take school away, and now kids are in this situation where if they're getting hurt or abused, they don't have any escape. At least for school, they were getting away for 8, 10 hours a day. Teachers and other people could watch out, see if there are any signs of trauma or abuse, and like get that to the appropriate authorities. We're in a situation where we're like not functioning regularly. That's an understatement of the year, I think. But the mental health like burden or outcomes of this we won't only figure that out 5-10 years from now when we come back and look at the data, because right now in the moment we have no idea what this is doing, what the lockdowns are costing us on a maybe we're lowering mortality, but are we lowering morbidity and mortality total? And I know in Tennessee there's a big shocking, like the second month of the lockdown, overdoses were up by like 100%.
Wow.
And we should look at the data and make sure it was exactly that, but it was a lot. It was like more than 50% up. And that doesn't make sense for a month. That just came out of nowhere, basically. Almost cause and effect between the lockdown and overdose.
Yes. And you brought up familial situations, and especially we don't really know what our friends, students are actually going through with their families and whatnot. But in general, though, like for a lot of people, it's like talking about mental health is, like you said, hard, especially with their parents. And now you don't see their faces, honestly, because of Corona. It just took it to the next level. And what I'm about to ask you is, different for every family. But what do you think is the best way to go about addressing that communication barrier between you and your parents, and basically fixing that generation gap and bringing common ground?
Yeah, I mean, first of all, I'm really impressed by all three of y'all and kind of the questions you're asking and how you're thinking about it. I mean, this is more thoughtful than almost any channel that I would turn to look at, a topic, like any forum or seminar or series. Like, you guys are really doing a great job thinking through this. The thing I'll say is being non-judgmental, being open, and being brave kind of all go together when talking about mental health. Because a lot of times people are in their darkest hour. They're in their, like, they're needing to share something that they almost wouldn't want to tell you. They wouldn't want to tell anyone. And that's sort of why I like my job. People open up to me, tell me things that they may not even tell their mom or dad, And so you kind of become somebody's parent sometimes, their teacher sometimes, their coach sometimes, you're just like needing to be there for them. But that's me in my profession. Now at home, I think you just have to be open, direct, and honest, and brave. Those are probably 4 words that I would use to talk about it, because you think you can't talk about something, and so you don't. But that doesn't make it better. It makes it worse a month later, 6 months later, 6 years later, 10 years later. So if you can somehow muster up the courage, it's usually better that you brought something up earlier than it is you just sticking onto it and thinking they wouldn't understand, or they don't want to hear this, or they don't want you to even, how are they going to react? Normally parents will react better than you think they will. Maybe the first reaction isn't exactly great, but they sleep on it a couple nights, think about it, and you guys have a better, more honest, truthful relationship with one another than you would have had you just decided, not worth it. And that's where I'm a parent, and I, think differently already than before I was a parent. Being a parent is hard. It is. There's like no way. There's no manual that comes with it. And so give parents benefit of the doubt, and parents need to give kids benefit of the doubt, and both need to have open discussions and be willing to learn from one another. There's no rule that the kid knows less than the parent, and there's no rule that the parent knows more than the kid on a topic. Now, in general, parents have more experience, so they probably know a little more than, us. Still listen to my mom and dad, probably not as much as they would like for me to, but I still try very hard. But I would say that that's the key: being brave, open, willing to listen, be non-judgmental, be direct. These are the things I would recommend for families discussing these topics.
So, in your opinion, why do you think it's hard for parents to sometimes understand their children's stress? Now, I know oftentimes parents will say, "Oh, we were kids too. We never went through this. It'll be all right. Go out, eat properly, go pray, go to, I know with us, like with South Asian communities, I've heard a lot of parents say, oh, go to the mandir, go to church, just pray." And so why do you feel like that's a thing? And what's one way you would recommend? I know we have parents joining us today. What's one thing you would recommend for them to come out of that mindset and to, look at their child?
Yeah, so first I'll say none of those are bad things. I think prayer and spirituality is like beautiful. It's wonderful. And
Yes.
And so like it can really help. I mean, there are many people who have avoided really bad outcomes because of their kind of spiritual base and they're kind of getting back to the roots and basics of church or temple or, whatever it is for them. That being said, there are a lot of other people that were kind of hurt by it because they were basically felt like what they were feeling wasn't real to other people, adults, people that were their protectors. And they felt like maybe they weren't close with God and they started feeling more guilty actually that maybe if I'd just been closer to God or if I'd just been this or that, I wouldn't be feeling like this. But I think, first of all, parents react in the best way that they can, but most parents are not behavioral health experts. So when you have a kid and you've raised them for 15, 16 years, they've been doing well, whatever, and all of a sudden they come to you and they're like, I have thoughts of wanting to hurt myself, or I'm so depressed I can't even go to class. First instinct for a parent is terror. Like they may not admit that, but the first gut instinct is just sick feeling. I'm so scared. I don't even know what to say next. And so they kind of resort to their safety blanket, their thing that maybe their parents told them and their parents told them, which might be, go to temple, pray about it, talk to God. These are kind of these are passed down for thousands of years. It'd be a lot harder to say, let's go see a psychiatrist. Because most parents in a perfect world would not choose for their kid to need to go see a psychiatrist. Yeah. They never think about it that way for a family medicine doctor or pediatrician, because that's kind of regular. This is what you do. You're not feeling good, you have a headache, you go see the pediatrician. But what if you're not feeling good and you're suicidal? All of a sudden, this is something you never in your wildest hopes thought that this would be your kid. So, and then you also wonder, what can that lead to? You're kind of stressed out. Are they going to be on a lot of medicines? Unfortunately, there's a lot of mental health professionals that have not been doing a great job and over medicating people and kind of putting people on too many things and not listening and being quick, 10-minute quick check, med check. You come in and out. If anybody's had experience with mental health, it may not be the best experience. Parents themselves may have gone to see a psychiatrist before and it, wasn't something that helped them. So they don't want their kids to not go through this. But what I will say is if parents can just understand, there's never been a generation like y'all. There's never been a generation where like this, the moment you were born, there's so much technology around you where the world was like never ending. We used to be like, you go to school and you'd come home and if school was rough, you at least had home. There was some separation. Or if home was there, bad, school was separation. But now your phone, you're never separated from anything. There's a lot of positives about technology, so many positives. We couldn't be doing this without technology.
Yeah.
But there's one negative where you can never disconnect from bad things. Like anytime you pull out your phone and start using your thumb and scrolling, think about it. The last time you scroll through Twitter, scroll through Instagram, maybe not as negative, but it has its own things, but like the news, like scrolling through, you're always seeing bad stuff happening. Instagram, you're kind of seeing a fake reality. People are trying to portray this like great reality of whatever they're trying to portray. No one is having as great of a time getting through life as their Instagram feed might make it seem. So then if you're feeling down and you think everyone else is having a great life, you just wonder what's wrong with you.
It's the worst.
But social media, y'all the first generation to grow up with social media from the day you were born to the day you will die. We've never had that. So like nobody knows how to react.
That was beautifully said. And I think that goes a long way for a lot of people in these types of situations. We really applaud you for that. And so one of the questions we got was from my friend in Delaware. And so he's been raised in a very strict and religious household. Now, and basically, you know, as you know, some people think more than others. And whether that be about random things, whether that be random thoughts, whether that be ideas, whether that be new things, everybody thinks differently. So basically, when he was young, he was like more, okay, I shouldn't do this, that's a sin. Oh, I shouldn't cut my hair on Tuesday, or I shouldn't cut my nails on Friday night, and all these superstitions, right? And so basically those thoughts, and basically him saying, oh, something bad will happen, something this will happen. I think you know where I'm going with this. He had a lot of symptoms of OCD, and very severe OCD actually. And I think now it's actually a gateway into schizophrenia. And honestly, right now, their parents are shocked. His parents are shocked. His parents are like, wow, like, you know, like I didn't think it would actually come this far, and we had no idea we were doing this. So how can we fix this? And right, and how can you prevent this from happening? And obviously religious standards are set, right? And a lot of people are more traditional, a lot of people are more open, but religion in essence of life. So in how do you feel like we make our parents understand that being a little bit more westernized, or being a bit more modern, or being a bit more lenient is not a taboo to your religion, and is not just a slap in the face for where you come from?
Well, if I had a really straightforward answer for that, I think it would be almost insincere, because, you know, there is no straightforward,
Right.
perfect answer to this. It is somewhat of a plight of a first generation immigrant's kid. You don't quite fit in with your friends, and you don't quite fit in with your mom or dad, or whoever, you know, you're being raised by. And so you're always doing this balancing act. You know, you're a little different when you're out with your friends from school, and you're a little bit different when you're out with your cousins or people from home. And the two worlds almost are incompatible in some ways. And that is very stressful. Now, there's statistics. Schizophrenia is increased in people who are going to a different community. So they're going from immigrants, basically. There's an increase in schizophrenia if you're leaving your home cultural environment and going to another cultural environment that is not the same as yours. So that's one. Now, the other thing is 1% of the whole world, any country you go to, 1% of the population will have schizophrenia. It's very interesting. Other things are different, like anxiety is more in America than it is in Asia. Now, I don't know if that's true, because sometimes I think maybe it's just not diagnosed as much, you know, but that is just statistically, there are some differences. But schizophrenia is the exact same in any country of the world. Pretty interesting. It's the only mental health disorder that really doesn't discriminate in any way, that's unique to any place. It's 1% everywhere. What I'll say is, so this is a case where I don't know if parents could have done anything differently that would have maybe not led to someone having schizophrenia. You know, I don't know the person. Maybe they do have that, maybe they don't, you know, and if they do, hopefully they get the help that they need. And that is not a death sentence. People with schizophrenia live lives and get medication, get treatment, and do better. But with parents, it's also tough, because a lot of parents left at whatever decade they left of their native country. They left with the cultural norms of that. So let's say they left in the 60s or the 80s. They still think that their home country is being run in that same form of like the 80s. But when you go back to their home country, they themselves would be on the more conservative end of their own country. It's kind of very interesting. And so this is specifically, I'm talking about for first generation immigrants. The parents have to be realistic about when they move to a new country. They did sacrifice a little bit of an idea that they may have had when they were 20 of how their kids will be. Had they stayed in their same country, their kids would be a little bit different than had they moved to a different country. That's just a fact. And so they cannot constantly be sad about that. They can't constantly be upset if their kids are not into the same programs, are not into the same sports, are not speaking the language the same way or as well. At the same time, the kids should be proud of where they're from. They should be learning about where they're from. They should not rebel against it, totally go alienate, against it, hate, be like, this is the worst, that type of thing. But it is a balance. And there are many households that are doing it very well. There are many households where it's just total chaos and dysfunction, and folks aren't even really barely seeing each other once they become adults. And you're seeing a lot of polarization. And it's easier said than done, but again, honest, simple, direct communication would be the best thing I would say. But parents are doing the best they can. It's really, I can't imagine, like I'm not moving from America. like I would not wish being a first generation immigrant upon anyone, like it's so difficult. Like I want to stay with my family where I'm comfortable. I know everything. Far less move thousands of miles, different language, different main religion, different, everything. So it wasn't easy for them. And so we need, as our generation needs to acknowledge that, but also understand that we're going to be different than how they may have thought their kids would be when they were 20, imagining their life. I don't know if that made any sense.
That made crystal clear sense.
And I think that the trend is also similar from people who are immigrants with an E. Whether it may not be 1,000-mile move, it might be a couple 100 miles. I know I can reference myself specifically. My dad's from Alabama. He grew up completely differently than I'm growing up right now. My mom she's originally from Kentucky. They all moved here to Georgia. So the trend is honestly the same there too, because they grew up in a completely different environment. We're growing up in a completely different environment at the same time. So it's like, you kind of see the overlap. They kind of want to try and instill some of how they grew up with you, but even though it's 100 miles away, it's still not relatable. It's still not the same as they intended it to be. So yeah, I'm actually glad that you did just delve into that. I kind of wanted to ask you a little bit of a personal question, if you didn't mind. Obviously, we know that you're a psychiatrist. We know your entire job is to hear what people are going through, hear what people are experiencing. But at the same time, you also go through some things as well. You're also a parent as well. I'm about to have a new child soon as well, which congratulations on that. But
Thank you.
What's your outlet? Because obviously you have to have something. You have to have something.
Yeah, well, I appreciate you asking. That's very nice. No one's asked me how I'm doing in a while. I always ask everyone else how they're doing. But I think for anyone that is interested in behavioral health to make that a career, first, please do it. We need more people. We need more good people. We need people that are passionate about it. But they need to find ways of compartmentalizing work and home a little bit and not bringing all the stuff they hear all day back home. But then they also can't bring any stressors or issues from home to work, because when they come to work, they have to be present. They have to be totally there for the patient. And even if the last person you saw, you just had a very tough encounter with, you kind of have to reset and go to the next person as if you hadn't done anything that day and you're starting all over. And that's what you have to give to people. And so you're exhausted by the end of the day. Doing that repeatedly, for 12, 14, 16 encounters, it's tough. But you have to have a check on yourself. People in my field that get into the most trouble not doing their best job is when they bleed their own lives into other people's lives. And there's a lot of ways around this. If you went through training, they teach you there's something called self-awareness. And there's literally specific self-awareness stuff that you learn how to do. And you even do some counseling or therapy yourself if you feel like these boundaries, you're not able to keep them. And so, I personally recommend anybody that's interested to do some counseling. You'll never believe how every other week or once a month or once a week, hour, sit down, reflect on your life, talk to somebody, listen, them listening to you, how powerful that is. But you don't have to do that if you feel like you can kind of compartmentalize, balance, draw, put away stuff before you see the next patient. But it's easier said than done. You'll always be bringing some of your own experiences to a patient encounter. And then just being aware of it and not letting it negatively impact, because sometimes that positively impacts. You know, like you may understand somebody better. Like if I was seeing an Indian American first generation kid that's talking about depression and having trouble with their parents, there's some stuff that I could bring to that discussion as a psychiatrist that somebody else just maybe couldn't. So there's not all bad bringing your own stuff, but you cannot ever let it be a big deal in the room. You know, like there's a reason, like for decades, psychiatrists were supposed to be a blank slate. You almost didn't know anything about your psychiatrist. They literally sat behind you. So like they wouldn't even see your facial expression. You know, you'd be talking and you had to be a blank slate. We're moving away from that a little bit. We're becoming more kind of regular people, you know, like trying to talk to you, kind of have back and forth, understand. But you cannot bring in too much of your own stuff to encounters.
And well, actually basing it off of that, you just went in on, obviously you just mentioned that sometimes bringing in your own personal life does help. Have you ever had an experience where actually talking about your personal life has impacted somebody and avoided that whole medication route? Have you ever had that encounter where, you know, just by talking, right? Something that a lot of people usually think that a therapist is there for. Have you ever been in that type of situation with patients?
Absolutely. I think several times listening, talking, more listening, less advice, more just reflecting back what you heard. I mean, that's like advice is pretty useless because people usually end up doing what they're going to do. People usually need to come up with their own reason for why they did something different. Like I could tell somebody stop drinking alcohol, right? Rarely ever works, because if it worked that easily, they wouldn't be coming to see you anyway. So I don't know if y'all have seen the movie Inception. Like the concept is like you basically plant an idea and it's like 3 layers deep, and then eventually that person thinks it's their own idea, but you had actually planted it. That's sort of what I feel like really good therapy is, when you can sort of listen to people, reflect back to them what they just told you, and they on their own kind of come up with, you know what, this is repeated behavior is really making my life bad. I might change my behavior, and they kind of come out of it on their own. Like you didn't tell them to change the behavior, but you did reflect back to them, here are the things that I keep seeing is happening to you based on what you keep telling me you keep doing. So I think many times you can avoid high doses of medications or more extreme things if you can kind of hold things in check, reflect on them earlier before they get kind of out of hand. And that's like absolutely true. I mean, very small percentage of people end up on medications long term. Most people work out these things based on these skills and coping mechanisms that they develop with, you know, whoever they're learning from or getting treatment from.
And I actually have a friend, he lives here in Georgia. So his family environment, he comes from, just like Akil's friend from Delaware, he comes from a very conservative family here. They're very active in the community and all. And so about a year ago, he started resorting to usage of alcohol and drugs, right? That was a way of him escaping his problems, escaping the mental, you know, that whole like stress of, you know, everything that was going on with him. Do you feel like that's an increasing problem amongst the youth? Do you think that the whole, you know, oh, and something's wrong, go smoke weed. Oh, something's wrong, oh, here's some whiskey, you know, chug it. Do you feel like that's increasing? And how do you think, like, you know, how do you think it's being combated? How do you think it's being, like, what's in place to reduce that?
Yeah, that's a very interesting question because I like to really read about this. Addiction is one of my favorite areas within my area. So there's actually some evidence that like the generation after millennials and maybe even the generation after that are a little bit more into wellness. They are less into, so there's data, if you notice, if you look at supermarkets and stuff, there's more like non-alcoholic options than ever before. There's more kind of wellness things. People are not indulging as a coping mechanism as much as maybe previous generations did. Now, I don't know if that'll stick, but that's sort of the early data coming out from the youngest generation that are just becoming adults. Now, the generations above them, 2, 3, 4, have been using substances more than really any generation really in America. I mean, there's very interesting stats about how the average lifespan for Caucasian males in America is actually declining. And it's largely related to the opioid epidemic. And it's something you don't really hear about or think about. There's some books written about it, but especially in rural areas, in places that used to have a lot of manufacturing jobs and used to have a lot of kind of blue collar pension type of things that are kind of been decimated, like our manufacturing bases in America have kind of gone overseas. So folks that had these good jobs don't have them right now. And so they're using substances at a very alarming rate. And so it's never the solution. It may make you feel good for a little bit, but it is never going to make you feel good for the long haul. If you are using drinks to cope, people use drinking to help sleep better, help anxiety better. Marijuana is the most interesting one because we could have a whole 4-hour panel discussion on marijuana alone, that one thing, because on some ways it's terrible. I mean, people are getting put in prison because of small ounces of marijuana. It's ridiculous in some ways because, like, what are we doing? Like, you know, we're like locking people up because of this plant. Now, on the other hand, places that are legalizing it are having spikes in psychosis in their ERs and are having more anxiety, psychosis issues because people are becoming paranoid or becoming sick. There's also a big syndrome with marijuana that kind of decreases productivity, decreases drive. You kind of have this like chronic, like low level, almost depression type of state. And then on the other hand, people will tell you it helps my anxiety. It helps my sleep. There's no, I'd way rather use marijuana than any of these psychiatric medicines that mess up my body, you know? So, I mean, I actually am not taking an opinion on any of those opinions. You know, like I personally am still, jury's still out. But I would say for the average person, first, marijuana is probably illegal in your state. So if it's illegal in your state, you're already doing something illegal when you're doing it. So that's not probably a good idea, right? Even if it is legal in your state, if you're having bad experiences, if you're not doing well, unless you're going to a doctor, unless you're getting something consistent, you don't even know what is in what you're smoking. It, you know, what percentage marijuana is it versus what percentage is it laced? What percentage is it something else? And it's hurting your brain. I mean, there's no doubt that it affects your brain, and there's more psychosis and more anxiety in folks that are using marijuana. So for any of those things people say, I drink to relax, I smoke to relax, it's actually helping. I get pretty skeptical. Is it really helping? And in long term, is it going to be a good solution or not? But I don't like when people make it this moral, ethical thing where you're a bad person if you're smoking or a bad person if you're drinking. That doesn't usually end well. And so I think we need to like really be open and honest about these discussions around substances. But at the end of the day, if somebody comes to my office, they're not doing well, they're smoking marijuana or drinking to excess, I would totally suggest stopping that. Because let's see what your brain is like without these substances. Let's get some chance to get you back to baseline, because whatever you're doing right now isn't working. So why keep doing it?
Right. And actually, segueing off of that, a lot of people, at least in Georgia, like a lot of my friends here, and then a lot of the friends I met through a program that basically encompassed the whole nation, party culture is very prominent. And now, obviously drugs are going everywhere. There's marijuana, there's alcohol. And now obviously at a party, no one's gonna be sad. Everyone's gonna have a good time. Everyone's gonna be happy. But basically when you do encounter a problem, you think back to how you felt basically, I guess last night if the party was then, and you're more inclined to using drugs. And I've seen this happen with like a lot of my friends. I don't know if this is like a real, like, you know, I don't know if there's a study on this or anything, but basically once you do it, you remember how you feel and you need more of it as time goes on. So obviously there's no way to actually fix quote unquote party culture. And honestly, it's not a moral, ethical problem. It's just like, what do you like? What do you want? If you want to have a good time, you have a good time. But basically, how do you basically make the youth understand that these quote unquote party drugs have deeper implications than just feeling good?
It's tough because when you're young, you feel kind of invincible. And the last thing you'll do is listen to some like old person like me tell you not to do something that's so fun and all your friends are doing it. Like if I tell you that, you're probably double likely going to do it. Like I might actually accidentally make you do it more because you're just like trying to like stick it to the system or stick it to, like the person authority figure trying to tell you to stop doing what you're doing. So I again go back to slowly trying to understand where people are coming from, always try to give them benefit of the doubt, try to understand why they think this is so important. If you're really interested in it, there's a whole series of ideas of the concept is called motivational interviewing, where you kind of lead people to the idea that you are saying that these things are really great and they make your life better and it's more fun or happy. But when I really take stock of the last 30 days of your life, here are like 8 other things that have happened in those 30 days that would really point to that things are not as great with these drugs or alcohol as you're saying they are. Let's like keep track of not just the good stuff, but the bad stuff. But there is good stuff. Like there's no way I could argue with somebody that tells me I feel more relaxed after having a couple of drinks. Like that would be a losing battle. Most people do feel a little more relaxed after a couple of drinks. But if that couple of drinks is turning into a lot more than that, or even the couple of drinks are causing problems, like if you've gotten a DUI or you've gotten a public intoxication, I would argue that this is a problem. It isn't all good. And usually people have to come to that understanding on their own. That's why addiction is one of the toughest areas to work in. Sometimes people have to hit rock bottom before they can come back. And unfortunately, sometimes people die when they hit rock bottom. And you can lose somebody right when, like if they had survived that incident, that would have been a life-changing thing. I mean, I've seen so many people, because I see people here at the psychiatric hospital who have just overdosed, but they've lived. And they were brought into emergency medical services. And I see them, it's like kind of deep, like maybe one day I would like to write a book about it or something. But like, I've seen people who we didn't know if their eyes would open again and they'd be alive or they'd be on the other side and they would have passed away. And I'm one of the first people sometimes, and not just me, my whole team, that they talk to. And like philosophically, deeply, you're talking to somebody that the last time they were alert and oriented, they wanted to die. And when their eyes open, they were either going to see like God or they were going to see you. And so like it's kind of interesting. Like they saw you instead, and they're still here on Earth, and they're still here in Nashville, Tennessee. And you talk to them, and the vast majority of people are glad that they're alive. Like whatever they were feeling in that moment that wanted them to overdose, the vast majority of people are grateful that they did not die from that overdose. And that means a lot to me. That means that people, even in their darkest hour, when they're not thinking clearly, have this like innate desire to live, even if they don't feel like that in the second or the minutes that they made the attempt or made the overdose. So, I don't think there's much we can do. Party culture on college campuses and things like that has existed for a long time. I don't think it's going away. But I do wish people were more careful. There's people dying for no reason. There's a lot of risks being taken for no reason. In any life, even one lost life because of alcohol or drugs on a college campus is too many for me. And that's a life. That's somebody that would have lived for 60 more years and added value to humanity, and now they're gone because of one bad night where they did something they probably would have wished they didn't do. And so no one's above that. Like, don't get behind the wheel of a car if you've drank at all. Like, this is not the time. Call somebody, get someone to pick you up, get an Uber. Like, never, ever, ever do that. There's not even one time. People try to, I only drank 1 or 2. No, never, ever. There's no reason. Same with overdosing and things like that. Don't put stuff into your body that you don't know what's going to happen once you put it into your body. It's just not worth it. Picture your parents, picture your family at your funeral. Like, what are they going to say out loud when the last time they saw you, you were eating dinner at the table, you went to college, and someone's calling them on the phone that your son or daughter is dead? Just don't do it to them, like that. That's just unacceptable. And I think we can all, work to do better.
I think one of the reasons that, and just with substances in general, whether that be party culture or just a drink here and there, a lot of it's a reaction to stress. It's a way to try and channel that and try and find some sort of outlet where you can forget about everything else that you've been dealing with and feel good for once. So, and especially now, especially with us about to go back to school, all of us are about to go back to school. So the timing of this is perfect. For us students and for the teachers who are having to deal with everything that is being thrown at them, really thrown at them as a fastball, don't know how to hit the ball. How do we deal with stress? What are some more effective ways to channel that stress somewhere?
Great question. And I kind of get both sides of it, because I mean, when you get MD and MBA, you're like in school forever. Basically, people used to make fun of me for how long I've been in school. But then my dad's also a college professor, and he's probably one of the most I've never met someone who cares about their students more than my dad. He gives everyone their cell phone number, but he has been more stressed the last 3 to 6 months than I've ever seen him, because he's he's 62-year-old guy, and he's being told move everything to online, move everything to he teaches finance. He's old school, chalkboard or blackboard, and showing you how to do getting right up to the board as that kind of person. So I feel for teachers and I feel for students. It's not going to be great for either, but we're going to have to make the best of it, because this is a new reality that we may even have next semester or next year, because even when there is a vaccine, which I hope that there will be soon, what percentage of people will get a new vaccine that just came out? Even with flu that's been around for so long, only about half people get it. And so if a substantial amount of people don't get the vaccine, we'll still be in the same situation next semester, next year, if it comes back, which most people tell me that it will. I'm not an infectious disease expert, but I think it'll be around. So with our new normal, we just have to kind of we can kind of take a moment to kind of mourn the loss of the past reality where it was so good. We didn't realize how good we had it, but just simply going to class was a privilege. It was awesome to see your friends, and we kind of dread going to class, but man, I'd kill to go to class right now. It'd be awesome to be with your friends, sitting in a row and listening to a teacher and writing stuff down and talking to each other. But we have to make the most of it. So I would say, know that everyone is not going to do perfect. So, be easier on yourself. If you're a teacher, don't expect every lecture to be perfect, but try very hard to make it very accessible to the students. And the students, you may make a few grades that aren't exactly what you would have made, because if you were in person, you may be able to learn better that way. But I think people are going to be okay. People are very resilient, especially professors and students. They'll adjust, but be easy on yourself. That's, I think, the one sentence I would say. Don't try to be perfect. This is going to be an imperfect semester. There's no way that that's going to be everything's just going to run smoothly. But also don't use it as an excuse. I can see some people being well, I'm going to blame it on the professor. The lectures were terrible. They never got it all online. They told me in October we had a final in November. You can blame other people all day. But at the end of the day, when you take Sociology 101, at the end of the semester, if you don't know anything about sociology, really you're the only one that lost out. The teacher already knows everything about sociology. They're already ready to roll. And so that was a class that you took, that you paid money for, and you didn't learn the stuff. So we need to kind of all, I think, take responsibility to try to do the best we can, knowing it won't be perfect.
Well, let's move into something about a psychologist. What are your major strengths and weaknesses as being a psychologist? Now, obviously, there's a lot that but there's also a lot that you might not know. And so how do you feel that makes an impact on people you interact with on your daily, whether it be patients, your family members, friends? List can go on.
Yeah, and we just did the thing where I'm a psychiatrist, and so one of the weakness that I'll say is psychiatrists are not as good at testing and therapy as a psychologist would be. So like as a profession, we are more moving towards neuroscience and medications and brain. We've moved a little bit away from kind of traditional counseling therapy, cognitive behavioral techniques. Although we get taught that, but we're not the expert. So I would say that, you know, one of our weaknesses is that we are becoming weaker as providers of counseling and therapy. We kind of really rely on the other professions, whether that's social workers or licensed professional counselors or marriage and family therapists or psychologists on that. Personally, I think that sometimes, you know, I always have to catch myself like getting too involved or too kind of like into cases, you know, like I have to let people kind of do things on their own. I can't go follow them around and help them make good decisions all day. And then I can't take when they don't do things correctly too hard. You know, like I kind of blame myself. I second guess, could I have said something differently? Could I have done something differently? But like, you just can't do that if you're going to try to have a 30-year career, you know, like if you're going to work for a couple of years, you can maybe be like that. But you have to kind of draw like some lines, some boundaries to be able to survive day in and day out. Even when you get phone calls, it's like that person you saw last week, they overdosed yesterday. And you're like, well, they were just in my office. How could this possibly have happened? But it could. Statistically, if you take care of patients and you take care of a lot of patients over your course of your career, and you take care of extremely sick patients, you don't shy away from difficult cases, you're going to have bad outcomes. Like any doctor that says, I've had no bad outcomes, they probably aren't taking care of the sickest of the sick, because that doesn't make sense. No cancer doctor can say, I've never had any bad outcomes. No surgeon can say, I've never had any bad outcomes. Similarly, no psychiatrist can say, I have no bad outcomes. There will be some suicides under your watch. There will be some overdoses under your watch. There will be some divorces or other things that you were trying to help prevent under your watch. And so you have to kind of not let it get you down. It's hard. You know, I mean, I think the worst I've ever felt are when patients let me down. And I should, it's weird of me even to say that. They don't owe me anything, but I do hope that they make good decisions and do well. I mean, that's part of my feeling about them. But when they don't, kind of take it a little personally sometimes. And so you got to kind of try not to let that happen.
So you basically, let's do a little recap. So basically, what should the youth be doing to get rid of this communication barrier? Well, know that your parents actually love you. They care about you. They'll understand, and it may not be as bad as it seems, right? What can the parents do to actually understand their child? Know that, especially, we'll look at first generation immigrants real quick. I mean, it's hard for the kid to adapt to the culture here because he gets sent to schools in America, not, you know, India, not Australia, not Africa. It's here. So for you to mingle with people here, you got to kind of be like them. So I think,
Yeah, or not Alabama or Kentucky either. I mean, that was a very
yeah.
point Jalen made, that I was saying like that, but I think he's exactly right. I mean, we're becoming more and more diverse culture, and there's more marriages that are different religions. There's more marriages that are different regions. There's, you know, so like any bit of that is kind of like a first generation immigrant's experience in some ways.
Exactly. And I think that right there, I think was my biggest takeaway from this. And it's just like looking at root cause as well. Like you said, maybe not like the taboo of it, maybe not the morality of smoking marijuana, maybe why. And I think that right there, to all the reviewers that are watching right now, I think that right there, a lot of youth with their parents actually are watching this right now. So I think a lot, you get more understanding on both sides. So,
No, thank you so much for, you know, taking time out of your day. It's midday on a Sunday. I know you're on call and stuff, so
yeah.
We're very thankful for you actually taking time out and, you know, coming to meet us and stuff.
Very insightful. You gave us a chance to ask questions that is very limited in terms of who we can actually ask, and then of course we ask questions from the community as well, to give them an outlet. That's exactly why we're doing this, why we're having this series. It's great to have people like you on board because you answered every question to the fullest extent that you possibly could, and we really appreciate you for that. So obviously, as Lokesh just said, thank you for taking time out of your busy day, your busy schedule, your busy life to come in and do this with us, to connect with us.
Thank you. And I think my friend in Delaware is very happy. Lokesh's friend in Georgia is very happy. And everybody who's going through something like this, is going to get better understanding for what they can do to make this better.
Appreciate y'all having me, and y'all three just keep doing this type of things. I mean, when the three of y'all are running the world, please don't forget me, first of all. But secondly, I think the world is going to be in much better shape and great hands when y'all's generation takes over. I truly believe in young people. I think we got to get us out of the way, let y'all take over. I mean, I just think that you guys are going to really solve a lot of the problems that some of us created. So good luck, and I'll be here to help y'all if you ever need anything.
Absolutely.
Thank you so much.
Thank you.
All right.
And with
Right.
that, Unity and Diversity's episode 1 of our mental health series comes to an end. Thank you everybody so much for joining us. Thank you to all of our viewers from all over the country that came in and took this session. We're very thankful to Dr. Abhi Saxena for taking time out of his day. He has a baby on the way. He has a lot of family, to take care of as well. And just taking this time out, we hope everybody is thankful for that as well. And we will be seeing you guys. We do have Mrs. Carolyn Berto coming in this Saturday on Town Hall, on our virtual Town Hall episode 11. She is the Democrat candidate for District 7 of U.S. Congressional. So guys, please join us for that as well. And with that, thank you everybody. Have an amazing Sunday afternoon and evening.